Joining us today, our special guest from RWJBarnabas Health is Mike Leviton, Blood Services Business Development Liaison with RWJBarnabas Health. Mike, thanks for joining us today.
Thank you so much for having me and discussing this very, very important issue.
Mike, why is now a critical time for folks to think about giving blood?
Well, we're in the summer months now, and a good bulk of our blood collections come from colleges and universities, high schools, which of course are closed right now. People are more likely to be involved with family activities and vacations. So in general, there are less people donating right now that we usually depend upon. So that makes it much more difficult to collect during, July and August because we don't have those sponsoring groups to step up and donate.
Are there any other examples of why there's a shortage, and who should give blood when we're looking at donators?
It takes all types, as we say, blood types to donate. We're not keeping up with demand. So less than 3% of people donate blood nationally. So that's really not enough to support the needs of our hospitals. We see this throughout the country at this time of year. New Jersey, actually, we collect less than we use. So we call that a net import state for blood, which is definitely a problem. So we also have to depend on other states from around the U.S. to support our needs. And traumas, medical emergencies, surgical procedures, all these things require, the blood to be there before it's needed. And cancer therapies especially, they don't take a vacation, right? We all do, but the need for blood never does.
Mike, who can give blood? What does blood giving involve?
Well, anyone, in general good health, between 16 and 75. 16-year-olds do require parental consent to donate. Other than that, 17 and above can donate freely. Donor has to weigh 110 pounds, 120 if they're 16. And we give like a little mini medical exam, a BP, pulse, temperature, and we take what's called a hemoglobin, which is an iron level. And if you pass all of those, then you make it to our donation area. And safe to say, all our donors, if you make it past our process, you're in great health and in great position to help another person. The donation process itself has 4 steps. You register, where we put in some of your data entry, just some of your information, name and birth date. Then you get the medical evaluation, like we said, which is that little mini medical. Then the donation, which, think of it this way, takes less than 15 minutes. Less than 15 minutes to save a life. That sounds good to me. And then at the end, refreshments and hydration, and we have snacks and juice and cookies. The whole process takes really less than an hour.
Now, Mike, when you give blood, how is it used to save lives, or how many lives can be saved?
Well, after you donate the blood, so basically what we do is we take 4 tubes, which are tested, and then the actual bag of blood, which is equal to a pint, is collected and sent to our lab. It's processed, and the components are what we call manufactured. So out of that bag, we can take red blood cells, we can take plasma. So it's 2 to 3 lives for each bag of blood. With platelets, it could be up to 3. And sometimes we take also cryoprecipitate. I know, a big word. But all those are units that help people, whether they have cancer, leukemia, people with bone marrow transplants. And platelets, they actually are collected individually at our donor room, really go to people that need chemotherapy or radiation treatment. And they only last 7 days. And all the blood that we collected takes up to 3 days to be tested. So you think of it this way, if it's someone you care about or someone you know, they don't have 3 days to wait for a blood transfusion. That's why it's so important.
Mike, finally, where can we find a place to give blood? For our listeners who are joining us and listening to you, how can they find a place to donate?
Well, they can go to our scheduling portal, which is www.donateblood.rwjbh.org, or they can call 732-235-8100, extension 221. I think, the main takeaway is the greatest gift that you can give is the gift of life. And all the blood donations and platelets and products that we collect here at RWJ stay here in New Jersey, benefiting our local patients at RWJBarnabas.
Great advice. Mike Levitin, Blood Services Business Development Liaison with RWJBarnabas Health. Mike, thanks for shedding light on this, and we hope lots of folks will get out there and help donate.
Great. Thank you so much, and everybody have a great day.